Hello, everyone. Hello again. Welcome back to our weekly CJL Live. This is, I think, the second CJL Spotlight, and we're going to be talking about reproductive health. So my name is Tsion Tulu. I'm a student coordinator at the Center for Justice and Law at Hamline University. And the Center for Justice and Law, the theme of this semester and this year is health, justice, and law. But this conversation is going to be around reproductive justice and law. Hi.
Hello.
Okay, so for today's conversation, we have Egezhiharya Yilma. You can just introduce yourself, some of the things you do.
Sure. Thank you for having me. My name's Egeziharya Yilma, and I'm a senior, just like you, Tsion, at Hamline University. And I study in public health and global studies, and I'm also passionate about maternal health, and that's kind of where I'm working right now.
Yeah. So I wanted you specifically to join me since we have a lot of conversations on the topic of reproductive health, whether it's like your concentration or your work or your research. So I think bringing that onto live and having other people see the kind of, hey Tina, the kind of conversations we have would be great. So you can just tell us a little bit about your work, either at Roots Clinic or your research area of concentration, anything that you feel is relevant, and we can just go from there.
Awesome. So, I currently am working as a birth assistant at Roots Community Birth Center, and it's a Black-owned, amazing birth center that really reaches out to the Black community and just like anybody else that is in need of medical assistance or just in need of support when it comes to them and their birth story. Beyond that, I also am an aspiring researcher, I want to say. I'm not going to say it fully yet, in maternal health and especially things like reproductive justice. I think maternal health, birth, all of these things go within reproductive justice, and just making sure that there's equity and making sure that there's sustainability within maternal health and within access to healthcare for mothers of all backgrounds.
Mhm.
Um, yeah, so I got into kind of maternal health professionally, I guess, through my dueling experience around 3 years ago or so. I professionally started working as a doula. I think that's a great way, especially doulas are great advocates, other than just the clinical aspect. They're great advocates for, the need and just everything else holistically around, care towards mothers. So I think, especially Hamline University, we have an amazing faculty professor, Colleen Bell. She is amazing when it comes to things like conflict resolution, but she also is one of the spearheading people when it comes to even programming and legislature around things like the Minnesota Prison Doula Project, where it's advocacy for women that are giving birth within prison. A couple of years ago, even women were chained up to give birth in prison. And, these advocates, they worked really hard and said that even though that these women are in an incarceration center, they do have rights and no person should be chained up while they're going through this type of an experience.
Yeah.
So they're successful actually in this. And they're replicating this model, not just in Minnesota, but within other states as well. So I'm really proud of Hamline and the way that it's spearheading justice.
Yeah. Yeah, the next question was about how justice goes into your work, and yeah, the Prison Doula Project is one of the leading, I think, initiatives talking about anti-shackling legislation and a bunch of other things. And coincidentally, next week, the next spotlight is going to be with Colleen Bell and one of our student coordinators, you do, and they're going to be talking more in depth about the doula project and the prison doula project and how policy and justice goes into reproductive health. So I'm glad that you brought that up. And I'm also like, I didn't know that you were part of the prison doula project or worked with Colleen Bell so closely on that. So that's crazy. And the work that you do with access and reproductive care and things like that, are there any areas of concern or issue that specifically speak to you?
Yeah. I think just some of these things I'm learning along the way, especially, when people work in advocacy or any part of healthcare, it should be a learning experience. I don't think there is really an expert when it comes to healthcare. I think there's the more experienced, but I think that there's always a learning opportunity for anyone, and no matter how many years or what type of accreditation they've received within healthcare, because it's just so dynamic and changing, and there's so many aspects to it. I think just some of the things that have really stuck out to me just recently is just the fact that when it comes to reproductive health care, it's not as just forward as we think it is. A lot of times people are thinking, okay, well, it's either with, like sexual assault, it's with just like anything else that's very stereotypical when you hear the word reproductive, and then when you hear the word justice. But there's so many other things that go into that, and even women not, or birthing people or anyone not having access to healthcare, it goes into reproductive justice, and it's not also just the birthing person, it's not just the person, there's also a whole community that's impacted by it as well. So we have to really understand, that it's just a very specific thing. And there's just many things that go into it. I know a part of the research for the Minnesota the Minnesota Prison Doula Project was that after these women give birth within prison, or after these birthing people give birth, what happens to the children that come out of that, and are they allowed to go then with a caregiver? Like what happens afterwards? And, this is all a part of it as well. It's beyond just the fact of, that one person too. It's, okay, well, the community around them, the children that come out of these systems as well. There needs to be questions asked, and there needs to be resources for them as well. So I think it's really great to understand, just there's a lot of people that need to be responsible, and there's a lot of people that also need their shoulders tapped when it comes to responding to issues within reproductive justice, and we need to make sure that we're holding accountable, and not just usually putting it on the patient or putting it on the person itself. There's other people that kind of do some of the legwork as well.
Yeah. No, those are amazing concepts to bring up, especially the continuum of care of reproductive health. You're right. And a lot of times when people are talking about advocacy and reproductive justice, it's typically in terms of that one time, which I think somebody called the birth year, which is like, that's the time that people typically think about, which is pregnancy, prenatal, and then birth and postnatal. And when it comes to motherhood and birth-giving person, all of these other things, many different aspects, many different social determinants go into it. And so it is very important to hold people accountable and hold systems and stakeholders accountable. That includes governments and policy, but also community activists and things like that. So I'm really glad that you brought that up. And we can maybe even venture further into global reproductive health, because I know that you also have done work in Ethiopia, which is amazing and commendable in itself. But to think about how reproductive health is seen, and the reproductive health gap is seen within other regions as well. So we can talk about that for a little bit as well.
Yeah. Sorry, I think it keeps breaking up on my end, but that is a huge phenomenon in its own. I think the way we understand reproductive justice, it has to change within not even in the global capacity, but also within the communities that we're serving, even in the US, right? So then when we bring it to the global scale, there's so many different layers and different threads that make up this web that go into it. A lot of times these things are, like also cultural practices, cultural stereotypes or norms. All of these things go into reproductive justice as well. So especially when I was in Ethiopia and I worked within a hospital there, some of my observations and some of my experiences was that a lot of times to address certain issues, or, address certain concerns that birthing people had, there was just a lot of obstacles also in the way of making sure that they have their needs met, besides just the cultural practices, you know, like of the people in itself. There's also this culture of the healthcare practice in itself. So not necessarily that it's understanding that it's different, right? And then also within those differences, it's also important that us healthcare workers, even if you know, for example, even if I'm ethnically Ethiopian, me going into this space that I am ethnically I ethnically am similar with, I still have this, you know,
Mm-hmm.
Western idea and this Western training when it comes to how I practice health and this Western way of thinking. So understanding that, okay,
Yeah.
well, I'm coming to this place as I'm observing it. Okay, well, this might not align with my training. This might not align with the things that I've been taught, but that's
Yeah.
just the normality of the way that they practice, right? And that's the
Yeah.
normality of how they respond to things that that how they respond to you know, that justice within their system, within their healthcare system and reproductive justice. And then understanding,
Yes.
you know, where can I you know, go and where am I invited to, you know,
Mm-hmm.
take up space. And also understanding where do I need to step back and also understand how the culture functions within that as well. I think that's
Yeah.
just a great thing to keep in mind, especially for those of us that are very interested in serving other countries on a global scale and super excited about taking healthcare somewhere else. We need to understand that healthcare does exist somewhere else. You know, responses to reproductive justice does exist somewhere else. And there's ways that we can improve these systems, but we also need to understand that some of these systems we are guests to,
Yeah.
and we can't just have we have all this tools within our kit. We can fix everything, you know, because there also may be some things that we can change in how we perceive health as well.
Yes, I think there's so many areas of learning that can be done. And typically, when people from the West, like you said, go into the global South or even other countries that are more developed as well, it comes with this idea of a savior mentality. And that goes from any area of health to medicine and reproductive health as well. So, especially when it comes to reproductive health and that continuum, it's so important to take in the feedback and the culture of that specific region, because the person that is the birth giving person is the person that's most sensitive to that, you know, to the feedback, to everything happening, to the practices that's happening. And so it's so important that when you're going into a space, you're cognizant of that, but also creating something sustainable and adaptable to that area. So I'm really glad that you brought that up. That's something that I think a lot of advocates within reproductive health, whether globally or locally, is something that's not really talked about as much and needs to be more of a focus, whether that's from a researching standpoint or an advocate standpoint. So thank you for bringing that up. Finally, we can leave it off at this. How can us at the CJL or viewers tuning in elevate the work that you do, whether that's in your research or the work at Roots Clinic? And what is one way that we can advocate and help in some of the topics that we've talked about so far?
Yeah. So just reiterating what you said, you know, reproductive justice is massive and there's many things that go into it. And birth is just, you know, like a little snippet of what it is, but it's so big and massive in itself and deep.
Mm-hmm.
I that, you know, I feel like I'm privileged to be able to be a part of an organization like Roots, where, you know, in every part of their work, they're giving holistic care to those that really need it, you know. So I think that more than helping me per se or my work, I would say that if everyone finds a way that they can, within their capacity or their interest, be go and work within an organization or go and work within a space, do research, be part of a research team, be an advocate, contact some of these organizations that are working tirelessly and say, hey, like, what can I do? Is there a drive that I can be a part of or something like that? I think that if we are always trying to, work towards the betterment of some of these organizations and the betterment of healthcare towards these populations and our community members, really, I think that's just the biggest way that we can all contribute to making health a better experience and making just these lived experiences better for our community members. So, like I said, keeping those words in mind, sustainability and all of these things, and using like either faculty member that we have or using community organizers, just using other people that are experienced within their within their passion and within their advocacy work, just helping and understanding where we fit in within our community and making sure that we amplify the space for the populations and the communities that we serve. I think that's the best way to do it. I know it's easier said than done, but it's easy as a simple email. It's easy as, an Instagram message or a LinkedIn message to see how we can help and following through with that service. I think that that's probably the best way to do it. But obviously everyone has something else. People, can only afford an Instagram post to share some events, and that's awesome. And people can, like lead on whole organizations or be a part of that. So I think that's wonderful too.
Yeah. I think also on an individual level, I know that if you are close to somebody like a birth giving person, I know that you gave me a lot of resources for my sister who was pregnant and giving birth at the time. And so even reaching out to community organizations, even in those cases, getting more information, getting that holistic care, as you said, which is so important in that time, is also some way that you can like get your foot into that area and know more knowledge and get more knowledge in your as not a birth giving person, but somebody who can help. So perfectly worded. Thank you so much for taking your time today. I know that you probably have a lot going on. So I appreciate your time, and thank you for everybody tuning in. Yeah, so the next CJL Spotlight is going to be next week, Thursday, 11:30 to 12, and it's going to be with Colleen Bell and You Do. And we are also going to be having a event later on this semester on the Prison Doula Project and anti-shackling legislation in partnership with a lot of other organizations. So please be ready for that. Thank you again, Eggy, and thanks everybody for joining. Bye. Let's see.